You can also suspend your hands like this in the air for like maximum 1 minute. You see, when you suspend your hands like this in the air, and then the blood flow, it will come to your finger easily, which will help you to have enough blood for your test. Monitoring blood sugar level is a fundamental aspect when managing diabetes, both for the individual and for the health provider. This helps them to make informed decisions. Monitoring blood sugar level is crucial for medication adjustment, the prevention of diabetes complication, the adjustment of diet, and even exercises. Like we always say, meting is waiting, which means to measure is to know. So if you don't actually measure your blood sugar level, then you won't actually know the measures to take at that particular moment. So in this video, I will be showing you step by step how to measure your blood sugar level in the comfort of your home, which means you as an individual can measure your blood sugar levels in the comfort of your home. Welcome to Let's Talk Diabetes with Mira Bikono. I am a registered nurse and a diabetes educator. My channel focuses on everything diabetes and also how to control blood sugar levels. If this is the type of content that you are interested in, then keep watching. So the first step in measuring your blood sugar level is for you to gather all your supplies. That is your glucometer or the blood sugar meter, your test strips, your needles or your lancets. You need tissue papers or compress. You also need needle container. So I have everything here with me. After gathering all your supplies, you then go ahead to wash your hands. Make sure to wash your hands with proper warm water. Why warm water? This is because warm water will help in the blood circulation. So when you wash your hands, you make sure you dry your hands with a tissue or with a hand towel, depending on what you have available. But make sure they are both clean. Do not use hand alcohol or disinfectant. No, we don't need them. The essence for washing your hands is just for you to keep your hands clean. They can also influence your results. The best thing for you is just to use normal water with soap. After washing your hands, you go ahead to prepare your glucometer. This is a one-touch variometer. So the first thing that you have to do is to install your needle. Like you can see, this is the prick pen. So in this prick pen, you have to insert your lancet or the needles. And with this one, you just have to turn it right, you remove it. Then in the middle, if you can look where there is a place there, you have to insert your needle there. After inserting your needle, you put the top back, you close it. It's closed. If you look, there is a hole there with the number 2. The 2, normally you can turn it to 6. Then you go ahead to install the length of the needle that you want to use. It depends on how deep you want it, but most often I advise my patients to use 3, to start with 3. So by starting with 3, definitely you have enough blood. You don't need to go to 4, you don't need to go to 5, you don't need to go to 6. 3 for this pen will be enough for you to have your blood. So after adjusting your pen, you go ahead and insert your test strip to your meter. Check your manual also and see how to install your meter. Then you go ahead, you put your test strips. You see it will come automatically on. After which it will request you to put a blood sample on the test strip. Then you go ahead with your clean or proper fingers, you prick yourself. Avoid using your thumb and your pointing finger. Why? Because your fingers, these two fingers, you often use them when you want to pick something, when you want to grab something. They are more active than this three finger, and when we keep pricking at a certain point, we will lose that sensation in our fingers, which is not good. So we avoid that by using these three fingers. It's not only this hand, you can use all your hands. So you go ahead and prick. You prick at the sides of your fingers, not on your finger top. Why? Because your finger top is more painful than when you prick at the side of your fingers. You've pricked and you realize you don't have enough blood. You don't just go ahead and start pressing your fingertip to have blood. No, you start from your palm. So you send blood from your hand palm to your finger. You push it to your finger. Then you will have enough blood. So now your test strip is requesting you to put a blood sample on the test strip. Then you go ahead with this method. You have to put your blood at the side of the test strip. So you go ahead and you place your blood and make sure you have enough blood, because if you don't have enough blood, then you won't get a result. It will come, either it will come false or it will just go off. Immediately you put your blood, it will count down automatically. Then it will give you the result of your blood sugar level at that particular moment. So monitoring blood sugar level with a glucometer, it gives you your blood sugar level at that particular moment. Is different from the HA1C test. The HA1C test is for 3 months, but this is for that particular moment. So take note. After having your result, you will see if you have a blood result under 70 milligram per deciliter, then you know that you have a hypoglycemia or low blood sugar level, which means you have to take measures to bring back your sugar levels high. If you see also that your blood sugar level is, for instance, 150, 180 or higher than 150, then you know that you have to take measures also to bring the blood sugar level down. After which you have to record the blood sugar level. It is very important for you to constantly note down your blood sugar level. Why? Because it gives you a direct knowledge of how your blood sugar is going. Then you can easily adjust to the kind of food that you are eating, or you can easily adjust to your exercises. Or when you see your blood results, you will know, this one is high because at this particular moment I ate so and so thing. Then you will be able to evaluate and adjust on your food or even exercise. With this AccuCheck guide, you have to put your blood straight. Remember, with the one touch, you use it at the side, but with this one, you have to just do it straight. But the procedure is same. It will still give you a countdown, and then it automatically gives you your blood sugar level results. After which, you use a tissue paper again to clean your fingers, to remove the rest blood that is still hanging on your fingers, and then you throw it in the waste bag. So that is just how you measure your blood sugar level at home. Make sure you gather all your supplies before you start pricking. Don't prick and then you realize, oh, you don't have a test strip, and then you are rushing to go and take a test strip. No, it's good to make everything and then you keep them within your reach. When is the best moment for you to measure your blood sugar level? Actually, the best moments for you to measure your blood sugar level is before every meal. That is before your breakfast, before your lunch, and before your evening meal. You can also measure your blood sugar level 2 hours after meals. That will help you to discover how certain foods they react on your glycemic level. then you can easily adjust them, either to take more food or to take a lesser food. Another best moment for you also to measure your blood sugar level is before going to bed. As a diabetes patient, it is of essence that you measure your blood sugar level before you go to bed. Why? Because most often, most people tend to make a hypoglycemia in their sleep without even noticing. But if you measure your blood sugar level before going to bed, then you will know that you have to eat something before going to bed to prevent low blood sugar levels. Before you prick your fingers, make sure you wash your fingers very well. Keep your fingers proper. Make sure you have enough blood before you bring it to the test strips. Wash your hands with warm water, and even you can also massage your fingers to bring blood to your fingers. So you massage your fingers before pricking. You can also suspend your hands like this in the air for like maximum 1 minute. You see, when you suspend your hands like this in the air, and then the blood flow, it will come to your finger easily, which will help you to have enough blood for your test. Remember to constantly change your needles. For instance, with this pen, you need to change your needles every day. So every time you want to prick, you need to change your needle because it's one-time use. But with this pen, you can use it up to 6 times before you change the needles, because there are 6 needles inserted in this pen. Prick at the sides of your fingers. Don't prick at the fingertip because it is very painful. And also, you send blood from your hand palm to your finger's tip. Don't press directly from your fingertip. No, it will affect your blood sugar results. It is advisable for you to store your test material in a dry place, advisable in your living. Avoid storing your test materials in your kitchen or bathrooms because of damp. Do not expose your materials to sunlight. And make sure you check on the expiring dates of the test strip. The test strips, they do get expired, so make sure you always check the expiring dates to see that you are up to date with your strips. So that was it for this video, a step-by-step monitoring of the blood sugar level in the comfort of your home. Remember, diabetes does not define you. With the help of good materials and good information, you are able to bring your diabetes under control. If you found this video helpful, don't forget to give it a thumbs up and also subscribe to my channel for more valuable diabetes content. Thank you for watching, and I see you on my next video. Bye.